Hey, Dr. Shalala, nice to see you.
Nice to see you.
How are you?
Good.
Good, good.
Thank you very much for doing this. We know you're busy. We will jump right in. This month, as you know, ASP is focusing on the transition from the Trump administration to the Biden administration, focusing on Biden's first 100 days and as he fills out his cabinet and sets his policy agenda. Before we jumped into all that, you're a former Congresswoman who spent many years in the Capitol. Wanted to get your reaction on the events that have transpired over the last few weeks in our government.
Well, I think it's appalling. And the president's lack of leadership, his egging on, inciting violence, is really sedition. And it's really treason when you get right down to it. He deserves to be to everything he's going to get, including being impeached for the second time. The House has done that. Now it's up to the Senate, but it's really shocking that he's been able to get away with this so far. And we need to stop him, not simply because he's going to leave office in a few days, but more importantly, so that no one else ever believes they can get away with this.
You were Health and Human Services Secretary during President Clinton's administration.
I was.
What is the Department of Health and Human Services responsible for specifically?
Basically, the health of the nation, as well as the welfare of the nation. It comprises some of the great scientific agencies, the National Institutes of Health, the Centers for Disease Control, the FDA, but it also includes welfare programs, most of the investment in childcare in this country, as well as covering things like the Indian Health Service, the Public Health Service itself, drug abuse programs. It really has wide-ranging responsibilities.
You've served in that role for 8 years. So basically, what advice would you give President-elect Biden's nominee in the Health and Human Services Secretary nomination process?
To put a team together, people that can work together. I'm less impressed by brilliance than I am about team building and getting a set of people that actually can work together. You can't get anything done. He also has to put expertise together. The people that head the agencies have to be among the country's leading experts in the subject, or you can't command the civil service and you can't execute policy. And finally, communications is critical, not only to the American people, but to make sure the communicators are the people that have the expertise, not the politicians.
Well said. How can the Biden administration better coordinate with states on the COVID-19 vaccine distribution?
Well, first of all, they have to get enough COVID vaccine out. It's hard to coordinate when states don't know from 1 week to the next how much they're going to get. So there has to be an overall plan, and we have to have literally millions of doses so that the states and the healthcare institutions they're using for the distribution, whether it's pharmacies or whether it's hospitals and clinics, that they can plan, take appointments, and get the vaccine out as quickly as possible. Right now, they're simply not getting enough vaccines to be able to plan the distribution in the large numbers that need to be done.
You recently said in an interview, you stated that we haven't really developed a laboratory strategy for infectious disease research. What steps can the Biden administration take to better prepare for future pandemics or outbreaks?
First of all, they can certify the laboratories that we have. We have an array of great research universities. All of them have laboratories. Most of those laboratories have not been certified to do the kind of infectious disease diagnosis, but they can do it. But it requires a CLIA, a special kind of certification. So we ought to use what we have. Second, we've got to fund the state labs. In the big states, more than one laboratory, and that they need multiple year funding because without multiple year funding, the states can't actually hire the kinds of people they have to hire and have people at the ready. And finally, we have to use the military laboratories that are actually scattered around the country. But we have to use every laboratory that we have, including some of the laboratories of the private sector. But I'm particularly concerned about the academic laboratories that actually could do this work.
Sure. Besides the COVID-19 pandemic, what are the biggest public health challenges that the Biden administration will have to address?
Getting rid of the next pandemic, making certain that healthcare reaches everyone so there are not these huge disparities. One of the things that COVID has told us is there are big disparities by race, by income, by location. And we need to close those gaps if we're going to be ready for the next pandemic. But more importantly, if we're going to improve outcomes, we spend enough money, but we don't have it in the right places, and we're not holding accountable the healthcare system so that people can actually see the outcomes, that we're getting good outcomes, that we're actually improving people's health.
Speaking of the system overall, this year the Supreme Court is going to vote on the future of the Affordable Care Act, specifically voting on the legality of the individual mandate. So first, can you explain to us what the individual mandate is? And then secondly, if the individual mandate is ruled unconstitutional, is there a path forward, and what is it for the Affordable Care Act?
Yeah, the mandate was originally put in place to get people to understand there was a requirement that they have health insurance coverage, and to get larger numbers of people taking the Affordable Care Act. It turned out that it wasn't that important, that people desperately wanted health insurance as long as it was affordable. The Congress can do this by removing the penalty. The Trump administration put the mandate at risk, and the lower court said it was unconstitutional, but the Congress could do this by having a $1 penalty, for example. But I'm not as crazy about the mandate as other people are. I want to make sure that we keep to the standard of comprehensive health care. The Trump administration has introduced these junk plans. So I don't think the mandate is as important, and I'm one of the few Democrats that will say this, as affordability is. We need to fix the Affordable Care Act so it actually is more affordable, particularly for the middle class.
Having served in both the administration and Congress, what's the most important thing each branch can do to ensure Americans get the health care they need going forward?
Working closely together, having the same goal, that every American ought to have access to quality, affordable health care.
Dr. Shalala, thank you so much. As always, it's a pleasure seeing you. I look forward to a time where you can make us a wonderful cup of coffee again.
Oh, good.
Still the best coffee we had in D.C.
As I made this one, I only thought this pales in comparison to the last time I sat with you. So
you guys are the best.
Thank you so much. Take care.
Thank you.
Enjoy.
Bye-bye.
Be safe.